Okay, I'm going to make this as efficient as I possibly can. 2 reasons why. I have a migraine, not going away. I took meds, still nothing. 2, I'm fucking pissed off, and when I get this way, my personality reverts back to what I call my personality from my previous life on Wall Street. So, I'm to the point. You know what? Sometimes people say it's rude. I don't fucking care. I just get to the point. That's my dog chewing treats, by the way. I'm trying to make him stop barking. All right, so what happened? I don't know if any of you use My Chart as an application for like your doctors, your children's doctors, anything medical, right? It's a huge messaging platform, whatever, that a lot of institutions use. Well, anyway, almost everyone that we use medically is part of that. So I got a bulk message. It just said bulk message from My Chart. And I was like, sweet, I wonder what this is about. No idea. Clicked on it, went in it. Turned out to be a generic kind of bulk, of course, message from Children's Hospital of Colorado. And it said, hey, I mean, it probably wasn't like that animated, but the message was, we have been issued, or the Department of Justice has issued a subpoena, and it is specifically related to our transgender clinic and seeking information. They didn't say what information. And then they said, you know, our lawyers are looking at it, blah, blah, blah. And I was like, what? Because I'd heard that this was happening, and it's something like 20 hospitals across the country had gotten this, but I was like, my God, this is real. Like, this is really happening, right? So I, of course, because I can't help myself, I actually called the Children's Hospital. And I was like, hey, yeah, about that subpoena. I said, what does it mean? She's like, oh, hang on a second. She read me some like random ass text. Not her fault, she's a messenger. About, hey, you know, we received this subpoena. We believe in client privacy. However, might have to comply with it. Lawyers are looking at it. And I was like, okay. Anyway, hung up after that call. And I was like, oh, interesting. What are we doing here? So based on the sources that I have, and this includes lawyers, includes transgender rights groups, includes therapists, a lot of different channels. They are all saying that the information that has been requested are patient names, patient birth dates, patient information in general, services received by those patients, the doctors and medical professionals that provided those services, and then also the parent information of those patients. Yikes. What the hell, man? Can we just back up? How do we get here, right? First of all, this is a part of the population. First of all, let's remind ourselves, children, right? Then the overall population of the United States might represent 0.1%, maybe 0.2% of the total population. Seems like a lot of effort by the part of the administration to go after a teeny tiny, not even a pie slice, like a crumb, a microscopic crumb off the crust of the population, right? Let's go back. Executive orders from January, right? What was the language in that executive order as it related to transgender health and treatment for minors? There were some pretty strong words in there. 2 of those being gender mutilation, which drive me fucking crazy. The other one was abuse, okay? 3rd word. Let's talk about it, okay? Let's educate ourselves. Let's remind ourselves of the facts before we just kind of buy in to this whole, like, farcity of, like, oh my God, parents are abusing their kids. They're getting sex change operations when they're 6. That's ridiculous. Okay. No. Number 1, being transgender is not a choice. I see children as young as 1, 2, and 3 who I can tell are not comfortable in their own bodies. And I'm not talking also just about transgender. I'm talking about LGBTQ plus in general, right? I don't know why this teeny tiny slice of transgender has been, identified. Whatever. It is what it is. Okay, it's not a choice. If you saw the struggle these kids go through, how they're not accepted, sometimes even by their own family, the schools, I wouldn't call them friends, the bullying, physical. How many times, maybe you haven't, seen the announcements on regular news channels about transgender children getting beat up, getting killed. It's brutal. A choice? Really? You fucking kidding me? No. So, what do these clinics provide for these children? I'm going to break it down into 3 things, okay? 1, mental health services. And those mental health services are desperately needed. These are children who are young, right? Confused about who they are in their body. They know they don't like it. They feel maybe guilt, maybe not. They feel that they're wrong. I don't know. But you know what? Without mental health services, do you know how high the suicide rate is for transgender youth? It can be over 40%. So yeah, let's get them some counseling. Let's get them some therapy. Not conversion therapy, for fuck's sake, right? Therapy, mental health. Big part of what these groups provide. Secondly, some medical services. What's one of the first ones? Puberty blockers. What the hell are puberty blockers? And I know I've talked about this before, but I want to remind everybody what they are. So, I'm going to give an example. Let's say that a child is born and the sex assigned at birth is female. And that child growing up does not feel comfortable in their own body. They don't want to get a period. They don't want to develop breasts. To them, it is mortifying. And for many, mortifying enough that they would threaten to end their own life, right? Brutal. Again, not a choice. I don't know why anyone would choose. It's not like some TikTok trend. So what do puberty blockers do? When that child is of the age of puberty, kind of varies, let's call it 11-ish, 12. That child, along with parents, legal guardians, experts, need I remind me, experts that have gone to school for this stuff and have training and know what the hell they're talking about. So in consultation with them, therapists, mental health providers, that kind of thing, the family, maybe there's a decision that child gets a puberty blocker. What does it mean? What is it? It's a shot or an implant, and it basically, for that child, stops their puberty at that moment of the either insertion of the implant or the shot. And some people will be like, oh my God, you're stopping development of the child. They're going to stunt their growth. My God, they're not going to be as smart as the other kids. No, again, can you please do your homework? Read some medical journals, please. Good God, people. What does this do? This allows the child to not have those signs, physical signs of puberty, of their sex assigned at birth that seem to be so mortifying to them. Well, let me remind you, it's reversible. This part is reversible. A lot of lies around that. So what would happen if that child should decide, along with that whole group and support network, that it is in the best interest of the child to stop? They will then just pick up on their puberty journey from where they stopped before and go on with their life. No effect on fertility, nothing. Okay? For the most part, very, very, very few children go that route. Many children then, for the next step, and this is where it gets a little more controversial, is they will start taking hormones. When does that start usually? I'm just going to say, I think it's generally around 14, okay? So what does that do? Let's go back to our example. The example of the child that was assigned female sex at birth who feels more male would start taking testosterone. What does that do? That would start the puberty process for this child as a male. So they would go through puberty as a boy. What else does it do? Maybe facial hair, maybe lowering the voice, that type of thing. Now, here's the important thing, okay? And this is where there's a lot of lies, there's a lot of deception, there's a lot of, I think, misinformation. But let's just get to the facts. Some of this information's right, some of it, I think it stretches the truth a little bit. So, when a child, sorry, I'm trying to feed my dog treats so he doesn't go fucking apeshit on me. Rex, stop it. See? Wall Street. When the child takes these hormones, there are very, very frank discussions. The doctors say, hey, listen, I'm going to ask you some questions that I shouldn't be needing to ask you as a 14-year-old. Because I trust you, that you don't feel comfortable with who you are, but I am required to ask you these questions. And especially, well, in the case that I mentioned, okay? And the discussion is, listen, if you start taking testosterone, it will damage your biological eggs that you have in your body from that sex you were assigned at birth, which means that you will not be able to have biological children of your own. I need you to understand that before we move ahead. You know what's interesting? I'm going to try not to get emotional. I'm moving out of my Wall Street vibe here. Any discussions like that I've seen, interviews that I have seen, anything of that nature, I have yet, and I'm not saying it doesn't ever happen, but I have yet to hear a child say, oh shit, really? Well then fuck it, I'm not doing this. You know what I hear most of the time is either, you know what, that's okay, I don't really want kids. Or kids that are smarter than us will say, well, if I want kids, there are a lot of other ways I can have children, right? I can foster, I can adopt, I can use a surrogate. So that doesn't mean that I can't ever have children. I just don't have them with my own eggs. So let's get off this concept of that these kids that make these decisions are never going to be able to have children, and get off the century-old myth that having a child means having it biologically. Stop it, okay? So old thinking, old-fashioned. It's just bullshit, okay? So then they get on these hormones, and then they go. Sex reassignment on a minor? No. I've told you before, the vast majority of, of any hospitals, I'd have to look it up. Rex, stop, I swear to God. That provide surgical intervention like that on a minor. And the way that this administration and people around it have twisted this into being genital mutilation, forced on a child, parental abuse. It's all bullshit. Bullshit. Don't believe it. Please, even if it's uncomfortable. You know what? When you're uncomfortable, that's when you learn. Talk to someone who's transgender. Talk to parents of a transgender youth. Talk to them about what they've gone through. Learn from the source, people, okay? Yeah, I'm angry. I'm pissed off. This whole thing, you know what? Focus on things that actually truly matter. And one more thing I'm going to say, okay? And this is whether it is transgender healthcare for minors, abortion, religion, right? Here's my view. Please don't legislate your ethics and morals on other people. What do I mean by that? Maybe I don't believe in abortion. Okay, then don't do it, right? How about I don't agree with your religion? I think it's cultish. And in fact, I think it's dangerous for your children. I think you've put them in a dangerous environment. Do I legislate and tell you you can't do that? No. I just don't do it for myself and my family, right? So, you know what? Don't put your own morals into the law. Don't put your own ethics into the law. Please. That's not what this country was founded on. That's not welcome here. Okay? That's it.